Hello everyone. I'll be presenting the journey of Punjab, a state in India, in scaling up screening and treatment for hepatitis C. This initiative is unique because it focused on some of the most vulnerable group, people who use drugs, prisoners who often face exclusion from mainstreaming of health system. Punjab approach shows how political leadership, active screening, and integration of services can bring about a large-scale health impact. Hepatitis C is a global public health concern, as you all know, with large number of people living with a chronic infection worldwide. People who inject or use drug are the primary drivers of a new infection in many countries due to unsafe injecting practices and overlapping vulnerabilities. Punjab in particular face a serious drug use problem. Studies reveal that the prevalence of chronic hepatitis C was between 8 to 10% among people who use drugs, compared with 3.6% in general population. This stark contrast demonstrated the urgent need for targeted and state-wide response from the government. Before 2016, hepatitis C treatment in Punjab was prohibitively expensive, which creates significant barriers. Laboratory facilities for confirmatory testing were few. There was no systematic approach for linking patients to care. On top of that, stigma associated with drug use, HIV, and incarceration meant those who were most vulnerable were least likely to access the treatment. The challenge was therefore both medical and social. How to design an equitable public health response that could overcome these barriers. In 2016, Government of Punjab took a bold step by launching Mukhyamantri, that means Prime Minister, Punjab Hepatitis C Relief Fund, which is also known as MMPHCRF. This program offered free treatment for all hepatitis C patients in state. But the real innovation came in 2017 when the government shifted from a passive approach, means waiting for the patient to come forward, to an active screening model. They began systematically screening the most at-risk groups, like people who are living with HIV at ART centers, people who use drug at opioid substitution therapy and agonist treatment site, and individuals in prisons. This was one of the most first program in India to operationalize treatment as prevention at such a scale. Implementation required building and strengthening systems, of course. Four viral load laboratories were established across the state, creating critical diagnostic infrastructure. A sample transport network was carefully mapped so that the blood samples from screening site could reach labs efficiently, reducing distance, time, and the cost. Medicines and diagnostic kits were procured in bulk, bringing down prices through large-scale negotiations and suppliers. Importantly, services were not standalone. They were integrated into existing HIV, drug use, prison health services, leveraging infrastructure. Sorry for that. Leveraging infrastructure and staff already in place. This allowed the program to scale quickly and sustainably. Between 2016 and 2020, more than 200,000 individuals were screened for hepatitis C in Punjab. This significant achievement for state-led initiative. Screening reached prisons, ART centers, and opioid treatment sites, population that had traditionally had been neglected in health planning and treatment centers. By actively taking services to where vulnerable groups were already receiving care, the program ensured early diagnosis as well. This not only facilitated timely treatment, but also reduced community transmission. since those diagnosed could be immediately linked to treatment. The treatment cascade is impressive. Out of more than 200,000 people screened, 85,000 patients were started on treatment. Nearly 69,000 completed their course, and over 52,000 were completely cured by this infection. These outcomes are comparable to the best international standard for direct acting antivirals. The program's success demonstrates that when treatment is made accessible and when services are delivered in a people-centered manner, even marginalized communities can achieve excellent cure rate. This is a powerful example of treatment as a prevention in action. Beyond the number, the initiative transformed the health system by reducing hepatitis C prevalence. It lowered long-term burden of liver disease and associated cost as well. It optimized laboratory capacities and streamlined workflows, reducing turnaround time for the test result. It also strengthened the linkages between different parts like HIV care, drug use, treatment, prison health services, etc., by creating a more integrated and resilient response. Moreover, it built a human resource capacity by training doctors, nurses, lab technicians, and counselors, leaving behind a stronger system that can now address other public health challenges as well. From financial perspective, Punjab showed that hepatitis C elimination is not only a health imperative, but also economically viable. Though in the large-scale procurement and tough negotiation, the state was able to drive down the cost of medicines tests significantly. This not only reduced the financial burden of the state budget, but also completely eliminated out-of-pocket expenditure for patients, which had previously been a major barrier. Politically, the program highlighted the importance of leadership. The government's commitment and investment turned a serious health crisis into a success story for other states and countries can be taken from. In conclusion, Punjab's hepatitis C initiative has shown that large-scale screening and treatment are feasible and effective in public healthcare system, even the resource-constrained settings. The key lessons are very clear. Treatment as a preventive works. Active screening among the most at-risk population is essential, and strong political commitment is the cornerstone of success. The Punjab model is scalable and replicable, offering valuable insight for other Indian states and low and middle income countries as well. With continued commitment, this model can help us move closer to the global goal of eliminating viral hepatitis as a public health threat by 2030. Thank you very much.